Welcome to the multiple choice question episode of the ASCO University Weekly Podcast. My name is Dr. Benjamin Levy, and I'm the clinical director of the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial Hospital in Washington, D.C. Today, we feature a question on the treatment of non-small cell lung cancer, and we begin by reading the question stem. A 54-year-old woman who is a never smoker presents to have her gallbladder removed electively when a routine preoperative chest x-ray reveals a left lower lobe opacity. A CT scan confirms a 4.8 centimeter mass that is biopsy-proven TTF1 positive adenocarcinoma. A PET-CT confirms the mass with a standard uptake value of 15 with no mediastinal adenopathy. After an endobronchial ultrasound demonstrates no mediastinal involvement, the patient undergoes a left lower lobectomy. The final pathology is a T2B-N1M0 stage 2B adenocarcinoma with 3 positive hilar lymph nodes. Molecular interrogation reveals an EGFR exon 19 sensitizing mutation. Which of the following is the most appropriate therapy for this patient? Answer A, cisplatin-based chemotherapy followed by erlotinib for 2 years. Answer B, cisplatin-based chemotherapy concurrently with erlotinib for 2 years. Answer C, cisplatin-based chemotherapy alone. Answer D, erlotinib alone for 2 years. Or answer E, observation. The correct answer is answer C, cisplatin-based chemotherapy alone. Multiple studies have demonstrated improvements in outcomes for patients with EGFR-positive stage 4 lung cancer treated with tyrosine kinase inhibitors, gefitinib, erlotinib, or afatinib, when compared to chemotherapy. But targeted therapies are currently not approved for earlier stage lung cancer. Several underpowered studies demonstrate no statistically significant improvement in overall survival with the use of adjuvant TKI, including the Canadian BR19 study and the Radiant trial. Thus, adjuvant erlotinib for completely resected EGFR-positive lung cancer should not be routinely recommended outside of a clinical trial. There is a clinical trial called The Alchemist, which is looking at this specific question, and hopefully we'll have answers soon. Adjuvant cisplatin-based chemotherapy thus remains the standard of care for fit patients with completely resected stage 2 to 3 lung cancers, irrespective of a biomarker, based on multiple phase 3 studies, as well as a LACE meta-analysis showing an improvement in overall survival. Rationale for wrong choices? Briefly, any choice that includes erlotinib in the answer is incorrect, given that targeted therapies are currently not approved for patients in the adjuvant setting. Also, answer E, observation, is also incorrect, given that multiple studies have shown a survival advantage with the use of adjuvant cisplatin-based chemotherapy compared to observation. Thank you for listening to this week's episode of the ASCO University Weekly Podcast. For more information on the treatment of lung cancer, visit the Comprehensive E-Learning Center at university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.